yield to Mr. Tonko.
Sure. Representative Garamendi, again, thank you for bringing us together. I think in addition to that, and you're very right, to have over-subsidized the Medicare Advantage programs, some 12 to 14%, people say, well, where are the cost cuts coming? Not from you, from the profit column. And actually, we want that to be transformed to something that's Medicare-related in terms of balancing the scales there and allowing our seniors to still have an advantage by having that program continue, but making certain that the oversubsidization is denied. And you're very right about the fraud and the abuse that may be part of that programming. But it's also important to note, I believe, that situations like medical home models and accountable care organizations will provide for the collaboratives that we need to coordinate the resources, to improve access, and to bring together the confluence of services in a way that streamlines without really hurting, actually helping the outcome for our seniors. And then, of course, free annual wellness visits, making certain that those co-payments, those deductibles, are not going to saddle individuals, again, having to be forced to dig into your own pocket. We will now have those free annual opportunities, screenings of essential types, the annual checkups. These are items that will not require, will be, actually co-payments and deductibles will be denied. They will not be disallowed, so that you go forward and you encourage the preventative and wellness approaches to healthcare delivery, which is an important aspect, I think, to the benefits of this program. We have to remember that the $1.2 trillion that's saved in the second 10 years out and the $138 billion that's saved in the first 10 years are just those budget-related scorings that were done by the Congressional Budget Office. But there are those who are suggesting that well beyond any kind of budget impact are the ripple effects of a good kind that will come simply by instituting wellness and prevention and access and putting clinics into the system, relieving our healthcare delivery system of uncompensated care burdens. A number of these things can't be scored by the Congressional Budget Office, so that it goes well beyond the $1.34 trillion that has been projected by a very conservative non-political CBO group. So I think there's reason for great hope here. And if we can instill hope, if we can insert hope into the lives of people, into the fabric of our healthcare opportunities, we're achieving a great deal. And again, because this is so critical in the lives of people and in the profit columns of businesses that provide jobs, this is an important discussion.
I really want to home in on what you're saying, but let me wrap up the senior part here, if I might. Let's be very, very clear about the Medicare program. First of all, the AARP, American Association of Retired People, say that this legislation is going to lower cost and improve care for seniors. Secondly, it's in the bill. No benefit cuts. It's in the bill. $250 in the pocket of seniors who have got their medical prescriptions in the donut hole to help pay for that. And that's this year, not 10 years from now, this year. Medicare Part D donut hole is beginning to close. It's going to take time because it is expensive and it does take a lot of money, but it's going to close by 2018. And there'll be significant drug discounts for seniors who use generic drugs this year, saving seniors, just as you said, millions of dollars out of their pocket, and that's not in the CBO score. Yield to Mr. Tonko.
Yes, I would have to add to your list of benefits in this measure is the stabilization of the Medicare Trust Fund, providing that trust fund as we go forward, being a stronger element out there, enabling us to again provide the Medicare benefits and services that are required. So, it's an important aspect. It's important to 113,000 beneficiaries in my district. So we want to make certain it's there. And I'm happy that
it's not on my list. You want to add to my list another benefit?
I will add to your list.
Well, let's do it right now.
We'll add to that list. And I'm glad, Representative, that you made mention that no benefit cuts are included in the language of the bill. So these are another bit of freedoms that we're talking about in this measure.
So we add to the bill that the Medicare Trust Fund is made solvent from something either 7 to 9 years.
9 years.
9 years. Okay, we added that one here. Medicare Advantage, we talked about that. The bonus to the insurance companies is gone, and that money is not sent off to some other program. That saving stays in the Medicare program. Reduce senior premiums, improve access, expanded benefits, extend Medicare's fiscal... I did have it here. I just didn't read it. Here's the Medicare fiscal health. And finally, the issues you were talking about, prevention, organizing the care so we have continuity of care. Mr. Ryan, I yield to you.
Well, just listening